Conference, Joyce Still speaking on behalf of Unite the Union. Conference, I want to start by echoing what many others have said and congratulate Jeremy Corbyn and our new leadership team for creating a shadow minister for mental health. And I too would like to wish Luciana all the best in her position. Far too long, mental health has not been given the same weight and concern as physical health. Millions of people in this country, day after day after day, are dealing with anxiety, depression and paranoia in what becomes a personal prison. It is often invisible, but the suffering experienced is significant. The mantra, when we're asked, we must feel we must always be okay, feeds the societal stigma of those experiencing mental health difficulties, which is said to be 1 in 4 of the population at some time in their lives. It feels as if finally mental health is getting the priority status it has long needed. Mental health difficulties among young people hold back their ability to learn, impede their chances of building friendships, can lead to bullying and damage their chances in life. Discrimination in our labour market often restricts those with mental health difficulties from gaining and keeping a decent job. The disgraceful attacks on social security and benefits that are being repeatedly carried out by this government are having a devastating impact on young people experiencing mental health difficulties most sharply. Many have reported that the punitive and tick-box assessment methods to determine if people should receive benefits and the government's cruel sanctions regime have made their mental health significantly worse. This has also been linked to suicide in some tragic cases. In July, after refusing to say where the 12 billion in welfare cuts would fall during the general election campaign, Osborne announced that from April 2017, any disabled person claiming employment and support allowance and placed in the work-related activity group would receive the same benefits as those claiming job seekers allowance. These are people who this government's harsh regime will have deemed not currently able to work, and they will lose approximately £29 a week because of these vicious cuts. People in this situation are struggling to survive on benefits as it is. They just can't afford to take this hit in their income. Approximately 250,000 people with mental health problems will be affected. Conference, we need to fight this government every step of the way, and my union, Unite, and fellow NHS workers are looking to be in part of the discussion to finally develop the positive mental health policy and action that is so desperately needed. Please support.